Right now, women all across the world are paying thousands of dollars out of pocket to have their most intimate, delicate tissues intentionally burned to like 60 degrees Celsius.
Which is, yeah, it's a profound amount of heat.
Right. I mean, you walk into a sleek clinic, you're handed this glossy brochure, and the whole thing is marketed to you as this painless rejuvenation miracle.
Right, a quick fix.
Exactly. A quick, high-tech way to fix severe menopausal discomfort. But what those brochures rarely mention is that if your body's sort of cellular blueprint isn't perfect, that supposed miracle can actually turn into permanent disfigurement.
It really is a stunning collision of cosmetic marketing and biological reality. Because we like to think of medical technology as this precision tool, right?
Yeah.
Something that acts independently of our own flaws.
Yeah, like it just does the work for you.
Exactly. But energy-based tissue treatments, they don't actually do the healing. They just inflict controlled trauma.
Oh.
And if your body lacks the physiological tools to, recover from that trauma, the outcome can be really devastating.
Well, welcome to today's deep dive. We have a massive stack of sources today. Clinical guidelines, FDA warnings, medical case studies, all exploring this incredibly common but heavily stigmatized issue. We're talking about genitourinary syndrome of menopause, or GSM.
And the absolute booming industry of vaginal rejuvenation lasers that target it.
Yes. And our mission today is to answer a very specific, critical question for you. Can connective tissue fragility actually increase post-treatment discomfort and lead to severe complications with these lasers?
To really get to the bottom of that, we have to look past the marketing language entirely. We need to understand the underlying mechanism.
Right, what's actually happening down there.
Yes, we need to map out what is happening at a microscopic level when you introduce thermal trauma to tissue that is already fragile.
So to understand why the tissue fails under a laser, we need to briefly map out the cellular collapse that happens during GSM in the first place. Because you, the listener, you probably know that menopause brings a massive drop in estrogen.
Sure, that's the well-known part.
Right. But it's not just a hormone deficiency, is it?
Yeah.
It's really the death of an entire microscopic ecosystem.
A total collapse. In a healthy premenopausal environment, the superficial epithelial cells,
The ones lining the vaginal canal.
right, those cells lining the canal, they shed every few hours. And when they shed, they release large amounts of a sugar called glycogen.
Okay, glycogen.
And that glycogen is basically the primary food source for a healthy bacteria called lactobacilli.
So the body is like constantly feeding its own protective bacterial barrier.
Exactly. But when estrogen drops off a cliff during menopause, that whole shedding process just stops. The vaginal mucosa thins out drastically.
So the food source disappears.
Pretty much. Those superficial cells drop to less than 10% of their previous volume. Without the cells shedding, there is a massive drop in glycogen. And without the glycogen, the healthy lactobacilli literally starve to death.
And nature abhors a vacuum. I mean, if the good bacteria die off, something else is moving in, right?
Right, commensal organisms. Things like E. coli become the predominant bacteria because, lactobacilli usually produce lactic acid to keep the environment acidic.
Keep the bad stuff out.
Yes, to keep it hostile to bad bacteria. So their absence causes the pH of the vagina to rise above 5. It becomes much more alkaline.
Which opens the door for infections and irritation.
Absolutely. And at the same time, deep beneath the surface, the fibroblasts.
The collagen factories.
Exactly. The microscopic cellular factories responsible for producing collagen, they essentially shut down. They go dormant. The existing collagen fibers sort of fuse together and elastin fragments.
So the result for the patient, and we see this all over the clinical sources, is a severe loss of elasticity, profound dryness, and what the medical texts call dyspareunia.
Which is severe pain during sex.
Right. And if you're dealing with this, you can feel discomfort just walking around or sitting down.
Yeah, because the tissue is literally paper thin at this point.
It's awful. And this is exactly the void that the energy-based laser devices claim to fill.
Yeah, the landscape of these devices is heavily populated right now. We're looking at things like fractional CO2 lasers, erbium YAG lasers, and radio frequency devices.
And they all claim to reverse this cellular atrophy.
They do.
But, and this is the wild part to me, they don't do it by adding hormones back into the system. I was looking at the actual physics of these machines in our stack, and they operate on the principle of controlled thermal injury.
That's the core of it.
They're inserted into the vaginal canal, and they heat the tissue to somewhere between 40 and 60 degrees Celsius.
Right. They create hundreds of these microscopic thermal wounds.
Yeah.
It's really important to understand the fractional part of this.
What does that mean exactly?
Fractional. It means they don't burn the entire surface layer off all at once. They stamp a microscopic grid of burns into the tissue.
Like a polka dot pattern of tiny burns.
Exactly, leaving tiny bridges of healthy, undamaged tissue in between each burn.
Okay, so the idea being that leaving some undamaged tissue speeds up the recovery while the micro wounds trigger this sort of emergency response.
Yeah.
Like the body senses a burn, sounds the alarm, and that controlled inflammatory response is supposed to wake up those dormant fibroblasts we talked about.
Right, forcing them to rush to the site and lay down brand new bouncy collagen and elastin, and it's supposed to force blood flow back into the area.
The clinical intent is to force the body to rebuild its own foundation.
Exactly.
You know, I've been thinking about a way to visualize this for anyone listening because it sounds exactly like aerating a lawn.
Oh, that's a great comparison.
Right. Like if you have a struggling lawn, you drive this heavy machine over the grass that literally punches hundreds of deep holes into the dirt, ripping out plugs of soil.
And it looks terrible at first.
It looks completely destroyed. But that intentional trauma shocks the root system. The grass is forced to breathe, expand, and a few weeks later, it grows back exponentially thicker.
That analogy holds up perfectly against the mechanical theory of these devices, but it also cleanly exposes the fundamental flaw in the treatment model.
Because aerating a lawn only works if the soil actually has the fundamental nutrients to grow new grass.
Right.
And it assumes the grass itself is fundamentally healthy enough to survive the shock of being ripped up in the first place.
Yes. And this is the connective tissue catch. This entire multi-thousand-dollar laser treatment relies 100% on your body's innate ability to heal from a burn.
Wow.
The device isn't giving you collagen. It is aggressively demanding that your body make it.
Let's bring this directly to our core mission for this deep dive. What happens when you try to aerate a lawn that's like built on sand?
Right.
What happens when a patient who already has fragile connective tissue undergoes this intense thermal trauma?
Well, the medical guidelines from the leading women's health clinics in our sources are explicit about this. Collagen tissue diseases completely preclude a patient from safely getting vaginal laser treatment.
Completely preclude.
Yes. If you have a condition where your body's architectural blueprint for creating collagen is faulty, a laser is incredibly dangerous.
The sources highlight conditions like Marfan syndrome or Ehlers-Danlos syndrome, specifically vascular EDS.
Yeah, vascular EDS is a severe genetic subtype that dictates incredibly fragile tissues. Patients with this condition have a very high baseline risk of severe bleeding.
I read about spontaneously torn arteries, too.
Yes, that's a huge risk. And they struggle significantly to recover from standard surgeries. Their tissues simply do not hold together or stretch or heal the way healthy connective tissue does.
So let's combine these two concepts. If you have an underlying condition like EDS that messes with collagen formation,
Right.
or, frankly, even if you just have highly fragile, paper-thin tissue from severe, untreated menopausal atrophy,
Which is very common.
inducing a 60-degree-Celsius grid of burns is not going to trigger some magical rejuvenation.
No, it won't. When you intentionally burn tissue that lacks the biological capability to manufacture healthy, elastic collagen, you get unhealable damage.
Unhealable.
Yes, because the body registers this massive thermal trauma. It panics. It tries to heal the burn, but it fails to create the complex, flexible matrix of elastin and collagen that it needs.
So what does it do instead?
Instead, it throws down whatever it can to close the wounds as fast as possible. And that emergency patch job is rigid, painful scar tissue, fibrosis.
Okay, wait, I have to push back here for a second.
Sure.
If this is literally causing scarring and permanent damage in vulnerable populations, how on earth is this a booming industry? Like, med spas wouldn't survive if every single patient walked out with permanent disfigurement.
That's a fair point.
There has to be a demographic this actually works for, right?
Yeah.
And if there is, why aren't the vulnerable ones being filtered out?
You're touching on the massive regulatory and educational gap that currently exists in this space, because some observational studies do show high satisfaction rates and symptom improvement for laser therapy.
Okay, so it does work for some people.
Yes, in generally healthy populations with mild to moderate GSM. The problem isn't that the machines are universally lethal. The problem is the setting in which they are used and the lack of rigorous screening.
Because they're often marketed as like aesthetic or cosmetic procedures rather than serious medical interventions.
Exactly. A patient might walk into a non-medical aesthetic clinic or a med spa, and the provider treats the vaginal laser the same way they'd treat a facial peel.
Oh, wow.
They might check a generic box for no major recent surgeries, but they completely overlook crucial medical histories.
Like what?
Well, if you have a history of keloid scarring, autoimmune diseases, previous pelvic radiation, or, underlying connective tissue fragility.
And nobody asks about it.
Right. If nobody screens for that, the stage is set for a physiological disaster.
Let's look at what that disaster actually looks like in the real world. Because we aren't just talking in theories here. The FDA has issued serious public warnings about the use of energy-based devices for vaginal rejuvenation.
Yes, very explicit warnings.
They cited specific data regarding severe burns, scarring, and chronic pain. And the Royal Australian and New Zealand College of Obstetricians and Gynecologists, RANZCOG, they issued a similar warning about permanent disfigurement and adhesions.
The clinical case studies outlined in the Nice By overview from our stack really bring the terrifying reality of this into focus.
Yeah, those cases were tough to read.
Consider the case of the 65-year-old postmenopausal woman. She presented with severe vaginal dryness and was sold 3 separate laser treatments.
Right, and a few weeks after her final session, she felt she had healed enough to engage in intercourse, and the result was just horrifying.
She suffered heavy bleeding immediately.
Immediately. And when doctors examined her under anesthesia later, they found 2 actual lacerations like physical tears in her vaginal wall.
But the long-term fallout was even worse for her. Several months later, she presented with severe, completely unmanageable vaginal pain.
Because of the scarring.
Yes, her vaginal canal had shrunk to just 2.5 centimeters in length due to profound fibrotic tissue.
2.5 centimeters. I mean, imagine going in for a treatment explicitly marketed to improve your intimacy and comfort, paying out of pocket, and walking away with physical lacerations and a near-total obstruction of your vaginal canal.
It's the supreme irony of the cosmetic approach to functional organs.
And hers is not an isolated report.
No, not at all. Another case in the stack involved a 68-year-old woman undergoing the exact same laser therapy. Instead of healthy tissue returning, the thermal trauma caused her body to lay down a crescent-shaped fibrous band mid-vagina.
Which is essentially a thick stricture of scar tissue, like a physical roadblock inside the canal, leading to worsening severe dyspareunia.
Exactly.
And then there's the 55-year-old patient who developed moderate pelvic floor hypertonus and severe levator ani muscle spasms after the procedure.
That one is really medically fascinating.
I want to pause on that one, actually, because why would a burn on the mucosal surface cause a muscle cramp deep in the pelvis?
That is a brilliant mechanical question. So the vaginal canal is supported by a complex hammock of muscles, including the levator ani.
Right, the pelvic floor.
When the laser induces rigid scar tissue, like that fibrous band we just mentioned, the surrounding tissue loses its natural ability to stretch.
Okay, that makes sense.
So when the body moves or during intimacy, that rigid scar pulls harshly on all the surrounding structures.
And the muscle detects that lack of stretch.
Yes. It senses an imminent tear, and it goes into full protective mode. It clenches to protect the area from ripping.
Oh, wow.
And because the scar tissue is permanent, that protective clench never releases. It becomes a constant, severe, agonizing muscle spasm.
If you connect these specific cases back to our core focus, I mean, this is the definitive manifestation of tissue failure. This is exactly what happens when fragile connective tissue is subjected to thermal trauma.
Absolutely.
It's like trying to patch a hole in a silk parachute with heavy-duty duct tape.
That's a great visual.
Right. Sure, the tape might technically cover the wound,
Mm-hmm.
but the minute you deploy the parachute, the duct tape refuses to bend. It ruins the aerodynamics and the flexibility of the entire structure.
And in a functional organ that relies entirely on elasticity and expansion to work painlessly, rigid scar tissue is basically a death knell for comfort.
A vital distinction has to be made between inducing healing and inducing trauma.
For sure. And the evidence for lasers is just not robust enough to justify the risks for everyone, especially when we look at the lack of massive, decade-long, multi-center, placebo-controlled studies.
The kind of studies that would actually prove they are safe for long-term, repeated use.
Exactly. We just don't have that data yet.
Which brings up, honestly, the most frustrating part of this entire stack of sources for me.
What's that?
Well, if lasers carry such extreme risks for anyone with fragile tissue, What are you actually supposed to do? Like if you listening right now are dealing with GSM, what does the actual medical standard of care recommend?
The clinical guidelines are nearly unanimous on this. The gold standard first-line treatment for genitourinary syndrome of menopause is low-dose, localized vaginal estrogen.
Okay, products like Vagifem pessaries or Ovastin cream. But how does that mechanically differ from what the laser is attempting to do?
It directly replaces the foundational element that went missing in the first place. Instead of burning the tissue to panic the fibroblasts into working, localized estrogen gently reintroduces the hormone.
So it just fixes the root cause.
Yes, it stops the cellular shedding from halting. That restores the glycogen, which feeds the healthy lactobacilli, which lowers the pH, which thickens the epithelium.
Wow.
It reverses the ecosystem collapse without a single thermal trauma.
And a crucial point for listeners who might be wary of hormone replacement.
Hmm.
Because it's localized, the sources note it has minimal systemic absorption.
Very minimal, yes.
You aren't flooding your entire bloodstream with estrogen. You are applying it directly to the local tissue that actually needs it.
And the sources also highlight another fascinating, highly effective alternative called intrarosa, which are DHEA pessaries. The mechanism here is a marvel of biology, honestly.
I was reading about the intracellular conversion with DHEA. It's wild. How does it manage to fix the tissue without altering your blood hormone levels?
Well, DHEA is a precursor hormone. When you introduce it locally, the individual cells of the vaginal tissue,
They just take it in.
yeah, they import the DHEA and act like their own private microscopic manufacturing plants. The cell converts the DHEA into active androgens and estrogens internally,
Inside the cell itself.
inside the cell. It uses those hormones to rebuild its own cellular walls and structural integrity, and then metabolizes them. Almost nothing leaks out into the general circulation.
So the cell just makes exactly what it needs, uses it, and cleans up after itself.
Precisely.
That is incredibly elegant compared to a 60-degree burn.
It really is.
And for people who absolutely cannot or choose not to use any hormonal precursors, the guidelines offer non-hormonal options too.
Yes, prescription-grade moisturizers like Yeesus or Silk are highly recommended.
And these aren't just like standard lubricants.
No, they don't just provide temporary lubrication. They contain polymers that bioadhere to the vaginal wall to retain water over days. Or treatments using hyaluronic acid, which acts as a powerful humectant, drawing moisture into the tissue.
They may not reverse the cellular aging process the way local estrogen does, but they are incredibly effective at compensating for the anatomical changes.
Right, providing serious moisture and reducing friction entirely safely.
Which leaves me with a glaring, uncomfortable question.
I think I know where you're going with this.
If localized estrogen and DHEA are highly effective, generally safe for long-term use, backed by decades of massive clinical data, and crucially, don't involve intentionally burning your most delicate tissues.
Right.
Why are we seeing a booming multi-million-dollar industry where people pay huge out-of-pocket costs for unproven, potentially disfiguring laser treatments?
The answer lies in a colossal failure of the medical system to educate patients, combined with the psychological mastery of modern marketing.
Yeah, the marketing is incredibly persuasive.
Consider the statistics provided in the epidemiological data in our stack. 70% of menopausal women experience symptomatic GSM,
70%.
but only 7% actually receive medical treatment for it.
70% suffer and 7% get help. It's absurd. I mean, you can go to a primary care doctor and they will ask you about your bowel movements, your diet, your sleep with a completely straight face.
Very standard questions, yeah.
But the second the topic approaches vaginal dryness or painful sex, they suddenly get very interested in their clipboards.
The stigma is profound. Women are often reluctant to bring it up out of embarrassment or, an internalized belief that pain is just a normal part of aging.
Which is so tragic.
And simultaneously, roughly 70% of healthcare professionals admit they rarely or never proactively ask their menopausal patients about genitourinary symptoms.
So you have an entire demographic of millions of women suffering in absolute silence, receiving zero guidance from their trusted medical professionals.
Right.
And into that massive void of medical silence steps the cosmetic aesthetic industry.
Exactly. And the terminology they use is incredibly seductive. The word rejuvenation, it implies a return to youth. It sounds high-tech, modern, and effortless.
Oh, it does.
When you are desperate for relief, feeling completely unheard by your doctor, a glossy clinic offering a painless laser cure in 3 quick sessions sounds vastly superior to applying a messy medicinal cream twice a week for the rest of your life.
Because human nature will almost always favor the technological shortcut.
Hmm.
We want the magic wand that blasts the problem away.
Even if the biological reality demands a slower, foundational, maintenance-based approach.
Which brings us fully back to the mission of our discussion today.
Mm,
The aesthetic shortcut only works if the physiological foundation is flawless.
exactly.
So to summarize what we've discovered in these sources, yes, connective tissue fragility profoundly increases post-treatment discomfort and the risk of severe complications.
Without a doubt.
And the mechanics of why are undeniable. Laser therapies rely entirely on your body's ability to heal from a thermal burn. If your collagen blueprint is faulty due to a connective tissue disorder, or if your tissue is profoundly atrophied, the laser does not rejuvenate you.
It just induces panic.
Right. The panic response forces your body to throw down rigid scar tissue, leading to lacerations, physical obstructions, and chronic muscle spasms.
It really forces us to draw a hard line between a cosmetic enhancement and treating a functional medical condition. The skin on your face is largely static, but the tissue of the vaginal canal requires dynamic elasticity to function without pain.
It leaves us with a pretty heavy thought to process. As medical technology continues to merge with the incredibly lucrative cosmetic industry, we really have to ask ourselves something.
What's that?
When we take the aggressive, burn-and-peel anti-aging tactics of the facial skincare world and we blindly apply them to our most delicate, functional internal organs, are we truly rejuvenating our bodies?
Or are we just deliberately ignoring the biological realities of how our tissues actually age and heal?
It's a question that demands far more scrutiny before anyone steps near a laser.
I completely agree.
We really are walking in muddy diagnostic waters, hoping the lawn just magically grows back in the sand.
Oh, well said.
Thank you for joining us on this deep dive. Hopefully the next time you see a glossy brochure promising a medical miracle, you'll think about the microscopic ecosystem underneath. Take care of yourselves, ask your doctors the hard, uncomfortable questions, and we'll catch you on the next one.